Thank you, Andy. And again, thank you to our friends at the media for helping us get our message out. As usual, I'll start off with some numbers. As of this morning, we have a total of 83 patients who are taken care of as inpatients across our system for symptoms of COVID-19. One of those is at Acadia Hospital, 5 at A.R. Gould Hospital, 1 at C.A. Dean, 44 at Eastern Maine Medical Center, 5 at Inland Hospital, 4 at Maine Coast Hospital, 3 at Mayo Hospital, 14 at Mercy Hospital, and 6 at Sebastian-Cook Valley Hospital. We also have 19 patients being cared for at home through our home care and hospice agency. The 2-week positivity rate stands at 28.5%, and 1 week at positivity rate is 29.38%. Again, those are tests run through our lab at Northern Light Health. The continued rise in positivity rate indicates that COVID-19 is more prevalent than ever in our communities and speaks to the need to get vaccinated and boosted, wear a mask in public, stay home if you're not feeling well, and continue all other healthy behaviors that can make a difference. We also have available our most recent COVID-19 hospitalization graphic. The numbers continue to show that those who are vaccinated have lower rates of hospitalization and severe illness. As we've noted before, this graphic represents a snapshot in time, and the data is constantly changing. The graphic, which is includes data compiled from this morning and will be shared in the chat. As the data shows, hospitalization rates are still high, but there is a way that the public can help us lower those numbers. Booster shots of the Pfizer and Moderna COVID-19 vaccines appear to be highly effective at preventing hospitalizations due to the Omicron variant, according to 3 new CDC studies published on Friday. The extra doses were 90% effective at keeping people out of the hospital and after infection, and 82% effective at preventing emergency department and urgent care visits. There are plenty of opportunities to get vaccinated or boosted. New this week, Presque Isle, we have a walk-in option at Northern Light Walk-in Care. On Wednesday and Friday afternoons, we will accept up to 50 walk-in people each of these days between 1 and 4 p.m. for those ages 12 and older. Again, this is at Northern Light Walk-in Care in Presque Isle. In addition to that walk-in option, we have locations across the state at our healthcare facilities, primary care practices, and retail pharmacy locations where you can schedule an appointment to get vaccinated or boosted. To schedule an appointment for a location near you, just go to our website at covid.northernlighthealth.org. And with that, I'll turn it over to Matt.
Thank you, Dr. Jarvis. Before discussing updates on COVID-19 treatments, I'd like to share some data from the whitehouse.gov website, which is national data that was shared during a White House press conference 5 days ago, highlighting the need for booster vaccinations. I'll share my screen. So on the first slide here, what was shared by the White House is booster effectiveness on COVID-19 cases, and this is incidence per 100,000 in the population. What's notable here is if you look at the date in which Omicron became the most prevalent variant, there was a subsequent uptick in COVID cases, as we've all seen, including at Northern Light Health. And if you look at the incidence rate between those that are unvaccinated, those that have had their primary vaccination series, and those that are boosted, there is a clear deviation here in that there is added protection from receiving booster doses. There is also protection from primary vaccination series, which again highlights the impact that vaccines have at reducing rate of infection in our population. And then clearly the lion's share of our COVID positive cases are in the unvaccinated population, which is a consistent trend that we've seen throughout. And then moving on to the next slide. This slide shows vaccine effectiveness against preventing risk of hospitalization, or in other words, severe illness from COVID-19. And you can see that the difference between Delta and Omicron is present, and that patients more than 6 months after receiving their second dose have a decline in vaccine immunity over time, or that waning of immunity that we've discussed before. And that is much more significant with Omicron than it was with Delta. And then if you march it forward after receiving a third dose, you can see that that third booster dose increases the protection offered by the vaccines up to that 90% threshold again. So again, the need for boosters with Omicron has never been higher and we encourage anyone that has not received a booster that's eligible to do so to please go out and get that booster to get your protection against the Omicron variant boosted back up. So I will unshare my screen here. And then I also want to talk about COVID-19 treatments. There have been some developments on COVID-19 treatment options to update you on since last week. The U.S. Food and Drug Administration on Friday took 2 actions to expand the use of the antiviral drug remdesivir to certain non-hospitalized adults and pediatric patients for the treatment of mild to moderate COVID-19 disease. Currently, remdesivir is the only COVID-19 treatment available that is not on short supply. This treatment is not currently allocated by the federal government and must be directly purchased for our patients. It's an antiviral medication given as 3 daily infusions to complete a treatment course and reduces risk of hospitalization by more than 80% in high-risk patients. Patients should check with their insurance provider about coverage of this option, as it's not included in Maine's federal allocations. Sotrovimab is currently the only monoclonal antibody that's effective against the Omicron variant. The state has announced that the federal government has doubled their allocation for Maine in the following week. However, it's still less than half of what Northern Light Health had administered in a single week when supply was not a concern and we had 3 monoclonal antibodies available to choose from. The oral antivirals molnupiravir and Paxlovid are also in limited supply and must be obtained via prescription. Currently, availability is limited to Hannaford and Walmart Sam's Club pharmacies. Northern Light Health looks forward to offering these treatments directly as well when supplies are made available. As availability of COVID-19 treatments is scarce across the country, requests for treatment are prioritized according to risk of hospitalization and death from COVID-19. And with that, I'll pass it off to Paul Boland to provide a staffing update.
Thanks, Matt. So from a staffing perspective, as of yesterday, 618 Northern Light Health staff were out of work due to either COVID infection or exposure and are awaiting test results. So because of this, staffing continues to be tight around the state throughout our facilities. As a result, we remain in contingency staffing at all of our hospitals. And under contingency staffing, the quarantine period is 5 days with a negative test if the employee is asymptomatic or mildly symptomatic with improving conditions. So to be clear, under contingency staffing, our staff are tested and testing negative before they're permitted to return to work on site. We did not have COVID-19 staff providing care in our facilities. And we are thankful also for the Maine National Guard, which continues to assist us at some of our hospitals to provide much needed relief for our staff. And we thank our staff again for their amazing work that they do every day. Just tremendous results and tremendous efforts from them. And I turn it over to questions.
All right, thanks, Dr. Jarvis, Matt, Paul. Today we'll start with WABI. Alyssa, you should be able to unmute now.
Okay, perfect. Thanks so much. I guess my first question would be to Dr. Jarvis. Can you kind of give us a state of the state here on January 26th? We're hearing that there may be some projections that Omicron could be the last, biggest wave here in the US. Are you seeing any of that? What can you tell us?
Yeah, Alyssa, that's a great question. So far, we have not seen much change here in the state of Maine. The last couple of days, we have seen some decrease in hospitalizations. However, our hospitalization rates, not just at Northern Light Health, but across the entire state, remain extremely high, as do case counts. And so while there is at least a little bit of a decline, it's difficult to talk about total case count numbers. As the state talked about last week, they are behind in reporting out to national databases. And so predictive models then are a little bit behind because of that data gap. So some encouraging news, but it's still a little bit too early to tell where we are here in Maine. And I expect that we, at least for the next couple of weeks, will continue to be talking about high spread in our communities and then unfortunately hospitalizations and deaths as well.
Excuse me, real quick, before we continue, Dr. Jarvis, Chris here. Can you tilt down your camera a little bit?
Is that a little better?
No, a little bit more, if you would. Can you do a dite more?
You're asking a lot now, Chris.
I know, I'm demanding.
There you go.
Our media partners will appreciate it. I think that looks good. Thank you.
All right, Alyssa, did you have a follow-up question?
I did. One more, please. I guess Dr. Jarvis, you could answer this one too, or anyone really. Speaking of hospitalizations, we're hearing there's been some incidences recently. People have reached out to us that patients have gone into the hospital with COVID, and in the process, they've discovered, or doctors have discovered, that they have another pre-existing condition, whether that might be a kidney disease or cancer or something. What can you tell us about that, as far as what you're seeing in Northern Light hospitals?
Yeah, so Alyssa, that phenomena, always occurs. We may see somebody that comes in for a procedure and has some lab work done, and incidentally, we find that there's an abnormality that makes us follow up on that. And so that's not anything unusual for us to do. I think what you're seeing now is just because of the large number of people who are coming into the hospital because of COVID-related symptoms, and often that does require some testing and workup, that we are noticing other things. What we've also seen is the opposite of that, is where individuals have come in for what we think are more routine issues, and then find out that they are positive for COVID, and that COVID is affecting that. So it might be somebody with diabetes who their diabetes is out of control, and we find out that, well, that's because they've actually been infected with COVID, and they may have an atypical presentation for that COVID infection. And so both of those things are happening across our health system now.
All right, thanks Alyssa, for your questions. Next up, we have David Marino, Bangor Daily News. David, you should be able to ask your question now.
Great, thanks. I think Dr. Jarvis and Matt would be able to answer this. Bangor's director of water quality tells me that they were looking at restarting their wastewater COVID testing program. It had been halted earlier in the pandemic. With many people taking at-home tests, several people with COVID being asymptomatic or not getting tested at all for a variety of reasons, is wastewater testing the most effective way to track local spread within a community?
Yeah, David, I think, everything is multifactorial. Any data that we get is something that certainly we can look at and use that as an assessment. I think right now, when we start looking at wastewater testing, one of the things that does, that sometimes is a leading indicator of how much disease we have actually out in our communities. As you said, there are people who are getting at-home tests, and those are not necessarily reported up to the state, and then individuals who just aren't tested at all. And so what we had used wastewater testing for before was really to say, oh, there actually is prevalent disease out there. We just haven't been made aware of it because we're not seeing the downstream effects of people requiring visits to the emergency department or hospitalizations. Now we're kind of looking at it as the other way, is this going to be an indication for us as when we start to see a lessening of spread of disease? And I guess that's really what our hope is, right? We will see that lessening of spread of disease, and hopefully by following some of the data from wastewater treatment, we will be able to know that the disease is decreasing. It'll take some time for that to happen, but any data is welcome data.
All right, David, did you have a follow-up?
Yes, I did. 75% of 5 to 11-year-olds in Maine's 5 most rural counties remain unvaccinated, not a single shot. That's months after the FDA approved giving them the shots. With rates being so low in especially rural parts of Maine, could more drastic measures be necessary? California is looking at requiring vaccinations for public schooling, for example. Could measures like this be a way to get people who wouldn't get the shots for their children vaccinated otherwise?
Yeah, for our responsibility in public health, really it's about education and trying to promote good health practices, including vaccination. Weighing in on whether or not there should be some intervention on a governmental or political level is really not something that is the purview of Northern Light Health or really, frankly, any other health agency in the private sector. And so from now, for us, it's just we continue to be here readily available. And as we said from the beginning, we will vaccinate every individual in the state of Maine as long as they want to get vaccinated. So we are here and ready to do that. If there are people out there who still have questions or concerns about vaccination, I implore them to reach out to a trusted source, which is usually going to be their primary care provider. And certainly we can provide that information at our website as well. Vaccines are safe, they're effective, and they're the best way to keep our children in school, keep them well, and keep the people around them well, which is equally important. So thanks for the opportunity to just repeat that message.
All right, thanks, David, for your questions. Next, we have Chris, News Center, Maine. Chris, you should be able to unmute now.
Hi, everybody. Thanks for taking our questions today. My first question, I believe, is for Paul, but it may also be for Dr. Jarvis. I just wanted to ask this question because it came across to me in a frankly in a Facebook message from a viewer. It was a question about potentially temporarily shutting down a couple of beds. I think there were a handful of surgical beds. There were, I'll see if I get the numbers right here for you. 5 orthopedic beds, 10 surgical, and 16 respiratory/oncology. And I'm just wondering, you know, kind of on two fronts. One, is this accurate? And two, if it is accurate, why is the hospital doing this? And is it related to COVID?
Sure. And so I'll let Dr. Jarvis respond to the specifics in terms of the bed numbers to see if that's accurate. But I can say that on a daily and frankly, even on an hourly basis, we look at our staffing complement to ensure we have the right staff with the right skills to take care of the patients that we have. And at times, it is appropriate that beds be not filled if there aren't appropriate staff to provide care for new or additional patients into those areas. So Dr. Jarvis may have some particular comments. It sounds like the comment based upon the numbers that you described is a comment from EMMC.
Yeah, and I agree. It's probably from Eastern Maine Medical Center. And I'll just, you know, my real comment there is about the specificity of those beds. You know, while we do have to identify beds that would be used for critical care patients, cardiac patients, even though we do have some units that are specialized for certain particular ailments, it's not that we close down those beds because of those ailments. It's really just the geography in the hospital. We have people that have different reasons for being in the hospital on just about every one of our floors across the institution. And so I don't want people to think that we stopped admitting patients who needed those particular services. That's not the case. As Paul said, this was really due to both staffing concerns and infection prevention control concerns, because obviously we can't be commingling people who are positive for COVID-19 and those who are not. And so sometimes that results in it. And again, this changes on an hour by hour basis. And we do everything we can to keep every bed that we can available and open, because we want to be here to have every patient in the right place at the right time.
Right. Totally understand. Thanks for explaining. The second question I wanted to ask you had to do more with the hospitalization or the hospital census graphic that you guys had sent out here in the chat. And I just want to pull it up so I make sure I get my numbers accurate. It does appear that we have, you know, when you look at the hospitalized, it appears to be about 50-50 or close to 50-50 of vaccinated and unvaccinated. So this question is probably for either Dr. Jarvis or Matt, because I know Matt presented with the PowerPoint presentation from the White House. Are we seeing that most of these people are they, one, what is the severity of their illness that they need to be hospitalized? Because we don't see those same higher numbers in ICU or ventilator. So one is, how severe is their illness, and then two, do we know how many of those people have received a booster? Because I know that was another thing that he mentioned with Omicron, that after 6 months following that second dose of an mRNA vaccine, that effectiveness of the vaccine seems to dip pretty dramatically. Thank you.
Yeah, so Chris, so we don't have that specific. I'll answer the second part first. We don't have that specific level of data to say these people have were boosted or not. In fact, as we said in the past, this graphic, when we say vaccinated, it means they've received at least one dose of a vaccine. So we're not even using the definition of fully vaccinated in that case. As far as the numbers, you are correct, but if you look at it, you know, as we go more to the right on that graphic, severity of illness there, it is less likely that a person who is unvaccinated is needing intensive care or ventilator support, and that's been consistent all the way through. We have seen an increase in overall hospitalizations of people who are vaccinated, but remember, in the state of Maine, we're now, I believe, upwards of 78% of individuals have received at least one dose of vaccine, and probably close to that are now considered by the CDC fully vaccinated, and we have 50% of eligible people who are now boosted as well. That becomes that huge population. So the unvaccinated population in the state of Maine is much, much smaller than the vaccinated population, and so it just shows how susceptible they are to the disease. As far as severity goes, again, we see that people who are vaccinated, particularly those who are boosted, even if they have a breakthrough infection, that their illness is less severe. And in fact, their length of stay in the hospital is much shorter than we see with people who are unvaccinated. And that's just, you know, that's data that's been consistent all the way along. I think the reason why you're seeing more vaccinated individuals as a percentage of our hospitalized group really has to do with the fact that, well, there's a lot more vaccinated individuals than unvaccinated individuals, and that the Omicron variant is just a highly infectious variant, and it just behooves us all to take every precaution we can, washing your hands, wearing your masks when you're indoors, and getting vaccinated and boosted if you're eligible.
Yeah, just one follow-up to that too is we've been working with our data teams to try to refine our data to capture just what you asked. How many of those individuals have received booster doses that are shown in our graphic that have been vaccinated? And while we're still refining the data and can't give exact numbers, what is showing is pretty consistent that the individuals that are showing as being vaccinated that are in our hospitals, the vast majority of them had received their vaccine more than 6 months ago, which is exactly what was reflected in the data that I showed earlier from the CDC. But our own internal data to be able to represent with a high degree of specificity, we're working on obtaining a more automated way to capture those results.
All right, thank you, Chris, for your questions. Next up, we have Patty, main public. Patty, you should be able to unmute now.
Thanks. This first question is for Dr. Jarvis. As we're seeing hospitalizations come down a little bit and the number of people in critical care and ventilators drop, how much is that translating into relief for hospital staff? I mean, is the workload feeling any lighter? Is it providing any sort of relief at this point?
Yeah, it's a great question. I think particularly for those that are working in our critical care units, it is a relief not to come in and having the high numbers of patients that we had, not just in critical care, but on ventilators for COVID. It has been a long time, and it's a trying time, but our numbers are still very, very high. I mean, when you're talking about Eastern Maine Medical Center alone having 44 patients who need to be treated for COVID, and remember that requires us to put on special protective equipment and be just that much cautious with those patients. We are still working very, very hard. I continue to thank our frontline workers every day. It is amazing what they have been able to accomplish, the resiliency they have shown, and the fact that they show up every single day just to help other people is an amazing thing. They deserve relief, and really the best way we can get relief for them is to limit the number of people who have to come in due to this terrible disease. And so again, doing all those amazing things that can be done, particularly vaccination, is the best way we can say thank you to them so we can help them out. But also at the same time, we are seeing an increase in people who need our services for things other than COVID, and we see that around the entire state. And again, with our lack of beds, particularly in long-term care and skilled nursing facilities, that just bottlenecks the hospitals even more, and makes it that much more difficult for us to care for everybody who needs our services, not just those who are afflicted with COVID.
Okay, thank you. My next question is for Dr. Marston. Dr. Marston, you were saying remdesivir is, there's plenty of supply, so that's not a constraint, but because it's kind of labor intensive, is staffing a constraint?
As of right now, that hasn't been our primary constraint. I think we've done outreach to all of our patients that are identified as being high risk that would benefit for COVID-19 treatments, and we work to place them for care. I will say that the adoption of remdesivir has been less because it's a 3-day consecutive infusion versus something that can be taken once. Also, as mentioned, it is a medication that needs to be purchased, and sometimes there can be some financial constraints in the way of receiving that particular treatment option in lieu of other options that are available. But we make it available as an option at Northern Light Health because we want to make every effective option available to our patients for COVID-19 treatment. And so if we have those that opt to receive that, we can make accommodations to get them in for treatment.
Thanks, Patty, for your questions. Next, we have Italia, WMTW. Italia, you should be able to unmute now.
Hello, this question is for Dr. Jarvis, and I apologize in advance if this is just due to a lack of understanding, but I just want to know, why are doctors working to develop vaccines for variants that will likely be pushed out by another variant before mass production of the vaccine is complete? And have you seen studies working on a single shot a year rather than boosters? And what do you feel about the productions of boosters in order to keep people safe in the way in which they're going about it?
Yeah, well, thankfully, right now we have an adequate supply of booster vaccines, so that's not a concern for us. Really, the reason my companies are working on other vaccines, particularly targeting specific variants and specifically the Omicron variant, is just because of the worldwide spread of that particular variant. And if they can do something that can target that, particularly with a vaccine that they can get out to countries that are not as fortunate as we are here in the U.S. of having adequate supplies, that's again a welcome advancement. And if they can produce that for one variant in a timely fashion, then that gives them the knowledge and ability to be able to do that for something that's coming down the pike that we haven't yet recognized. So that's the importance of why that continues to be studied. The analogy I use there is that, when we put seatbelts in cars, we realized that made car driving safer. But we didn't stop there, right? We added airbags, we improved braking systems, we continue to do things to make driving safer. Well, same thing in healthcare. Just because we found something that was effective doesn't mean that we don't continue to work to try to find something even more effective. And so that's where we're at. As far as trying to find a vaccine that may limit the number of times that we have to get vaccinated against coronavirus, really only time will tell. The challenge with coronavirus, like we see with influenza, is that we just don't get lifelong immunity to a particular strain of a coronavirus, and the virus obviously mutates very quickly, much more quickly than we've seen coronaviruses mutate before, and therefore it just becomes that continuous challenge. Unfortunately, only time is going to tell what it is that we can have. If we come up with a vaccine that targets something that's universal from all coronaviruses, that would be wonderful, but that's going to take some time to develop.
Thank you, doctor. And I know that you said earlier that there was some decrease in hospitalizations, but they still remain extremely high. So do you expect hospitalizations to drop even further if and when this new stealth Omicron variant hits Maine and possibly becomes the dominant strain?
Yeah, all of that's too hard to tell and way too early to predict right now. What we've seen in the past is we see a wave of infections in our communities, followed by a wave of hospitalizations and unfortunately deaths. And then as the community spread decreases, just like as it came up, we start to see a decrease in hospitalizations and deaths as well. We hope that's happening. We have seen some evidence around the country that there are some pockets of areas where that is already starting to at least be statistically significant. Hopefully, as Maine usually lags at least 2 weeks behind the rest of the nation in terms of respiratory viruses, we'll start seeing some reprieve in the month of February, and certainly any reprieve would be welcomed.
Thanks, Talia, for your questions. Next, we have Joe Lawler, Portland Press Herald. Joe, you should be able to unmute.
Yes, hi. Most of the questions have been asked, but I do have a couple. Are you noting any regional differences in hospitalizations? Are they coming down faster in southern Maine versus northern Maine or western Maine, et cetera? Or do you think it's about the same?
Yeah, we've been challenged that this virus just doesn't act in any way that we've seen other things do, and so it really has been regional. And we've talked back and forth about sometimes the southern half of the state has the higher prevalence of disease, and sometimes it's the northern half, sometimes it's the western area, and sometimes it's the eastern area. As much as those of us who follow the state day would love to be able to predict what happens next, we have not been able to do so. And so it really is very varied. And until we see the entire state seeing some reduction in disease, I think it will just continue. And of course, we're a traveling group of people, right? It doesn't matter, whether you live in the northern part of the state or the southern part of the state. We tend to travel back and forth, and therefore, if one place is high, it's just inevitable that another place will see spikes as well.
Okay, thanks. And my last question is for Paul. Are staff absences down or about the same in comparison to a week or two or a few weeks ago?
So at 618 people, that's the highest number we've had since the start of the pandemic. And so that's a large number of people out of work. It's about 5% of our workforce, and that's not including people who might be out for other reasons, for regular planned time off or other non-COVID related illnesses. And so that's a significant increase from prior. It's about 35 or so people higher than last week. So it's not dramatic in terms of a percentage, but 35 people up from last week is a significant number to us, and certainly it poses challenges. One of the best things that we're doing to encourage and support our staff and return to work is to boost our staff. Matt showed the data on boosting and its effectiveness toward Omicron, and boosting, no pun intended, the resilience to significant illness. And so that is the big push. We're about 60% boosted among our staff right now, and we're continuing to encourage our staff to be boosted.
All right, thanks, Joe, for your questions. Dr. Jarvis, Matt, Chris had a question in the chat. I didn't know if either one of you might want to address it about Omicron, misinformation, disinformation, how we're combating that, if we're experiencing any of it.
From my perspective, I think the number one thing that I hear for disinformation is that Omicron is not severe and that I shouldn't worry about it, that the severity of illness is less than Delta. So while the severity of illness may be less than Delta, we still absolutely need to worry about it. And as Dr. Jarvis explained, the infectiousness of Omicron and how rapidly it spreads and the number of cases that we see and the rate in which those cases increase is unprecedented. And that really has the capacity to move through our population very quickly, infect a large number of people, and overwhelm and strain both our healthcare systems, our child care infrastructure, our workforces that are trying to stay open and do business. And then the tip of the iceberg, so to speak, of the severe illness still has been holding steady. We still have a high number of hospitalizations, and as a percentage, it might be less, but the sheer number that are in our hospitals certainly is not less. And that has a large part to do with just how infectious Omicron is as a variant. So it definitely is a concern, even though it is inherently a little different than what we saw with Delta.
Yeah, and I'll echo that same sentiment. And if we look at deaths, similar data, so the number of deaths per day from during this Omicron surge is equal to the number of deaths per day of the Delta surge. And so, that just shows you this is still a deadly virus. While the percentage of deaths from people who have COVID is less, that's only because of the sheer number of people who are being infected right now, but it's still a deadly virus, and we need to be careful about that. And we need to understand that we cannot predict who it is that's going to die from COVID, who it is that's going to require these hospitalizations. And then the other factor is that Omicron is infecting far more children than we saw with any of the previous variants, including children that now require hospitalization. And so if you care about those individuals, you care about the individuals around you, and you care about the individuals in your community, the best way to protect all of them is to protect yourself. And protecting yourself means getting your vaccine if you haven't started the series yet, or being boosted.
All right. Thanks all. Well, we made it through our list of questions for today. Thanks all for attending, as always, helping us get out credible information about COVID-19. As I mentioned at the beginning, we won't have the high quality version of the video, but we will have just a regular Zoom recording if you do need it for any reason. Just let us know. Also a reminder that COVID-19 inpatient graphic that Dr. Jarvis mentioned at the top is in the chat. And if you aren't able to grab it or need help with that, just let us know. With that, I'll turn it back over to you, Dr. Jarvis, for the final word.
Thank you all. I apologize for my technical difficulties today, but thankfully we were able to rectify those quickly. Again, we appreciate you getting our message out. It is important that we spread the truth and facts about this virus and that we get it under control so that we can all live better lives. So thank you very much and have a great day.